Inflammation is a natural process that helps your body heal and protect itself from harm. It's your immune system's way of fighting off invaders like bacteria, viruses, and injuries. When something triggers inflammation, your body releases chemicals that cause blood vessels to widen and become more permeable. This allows white blood cells and other healing agents to reach the affected area more easily. Imagine you've just cut your finger. The area around the cut will become red, swollen, and painful. This is inflammation at work. The redness is caused by increased blood flow to the area. The swelling is due to the accumulation of fluid and white blood cells, and the pain is your body's way of telling you to protect the injured area. Inflammation is usually a good thing. It's a sign that your body is doing its job to heal and protect you. However, sometimes inflammation can become chronic, meaning it lasts for weeks, months, or even years. This can happen when the immune system is constantly activated, even when there's no immediate threat. Chronic inflammation can have serious consequences for your health. It's been linked to a wide range of diseases including heart disease, cancer, arthritis, and Alzheimer's disease. The acute inflammatory response is the body's immediate reaction to injury or infection. This rapid response is characterized by a series of coordinated events designed to neutralize threats and initiate tissue repair. The first stage involves the release of chemical messengers, such as histamine and prostaglandins, from damaged cells. These chemicals cause blood vessels to dilate, increasing blood flow to the affected area. This increased blood flow is responsible for the redness and warmth associated with inflammation. Next, the blood vessels become more permeable, allowing fluid and white blood cells to leak into the surrounding tissues. This leakage is what causes the swelling or edema, often seen with inflammation. The white blood cells, particularly neutrophils, play a crucial role in engulfing and destroying invading pathogens and cellular debris. Finally, as the acute inflammatory response subsides, the body begins the process of tissue repair. This involves the removal of damaged cells and the formation of new tissue. The acute inflammatory response is a vital part of the body's defense mechanism, protecting us from harm and promoting healing. While acute inflammation is a normal and beneficial response to injury or infection, chronic inflammation is a persistent, low-grade inflammatory state that can have detrimental effects on the body. Unlike acute inflammation, which is self-limiting and resolves once the threat is eliminated, chronic inflammation can persist for months or even years, silently damaging tissues and organs. Chronic inflammation is often triggered by underlying factors such as obesity, smoking, chronic stress, and exposure to environmental toxins. These factors can disrupt the body's delicate balance, leading to a state of constant immune activation. Over time, this chronic inflammatory state can contribute to the development of a wide range of chronic diseases. For instance, chronic inflammation plays a significant role in the development of cardiovascular disease by promoting the buildup of plaque in arteries. It also contributes to insulin resistance, a key factor in type 2 diabetes. Moreover, chronic inflammation is implicated in the development and progression of neurodegenerative diseases, such as Alzheimer's disease and Parkinson's disease. The link between chronic inflammation and disease is complex and multifaceted. Researchers believe that chronic inflammation contributes to disease development through several mechanisms. Persistent inflammation can damage cells and tissues directly, leading to dysfunction and disease. For example, in rheumatoid arthritis, chronic inflammation in the joints damages cartilage and bone, leading to pain, stiffness, and deformity. Chronic inflammation can disrupt the normal functioning of the immune system, making the body more susceptible to infections and autoimmune diseases. In autoimmune diseases, the immune system mistakenly attacks the body's own tissues. Inflammation generates free radicals, unstable molecules that can damage cells and DNA. This process, known as oxidative stress, is implicated in the development of many chronic diseases, including cancer and heart disease. Chronic inflammation can lead to the abnormal growth of tissues and blood vessels, a process known as tissue remodeling. This can contribute to the development of scar tissue, organ enlargement, and even cancer. Section 5. The systemic impact of inflammation, a whole body affair. Inflammation, once thought to be a localized process, is now recognized as a systemic phenomenon with far-reaching effects throughout the body. This systemic impact stems from the fact that inflammatory mediators, such as cytokines and chemokines, can travel through the bloodstream and exert their effects on distant organs and tissues. For instance, Chronic inflammation in the gut, often caused by an imbalance in gut bacteria, has been linked to increased risk of cardiovascular disease, type 2 diabetes, and even depression. Similarly, chronic inflammation in adipose tissue, or body fat, is a key driver of insulin resistance and metabolic syndrome. The systemic nature of inflammation underscores the interconnectedness of various organ systems and highlights the importance of addressing inflammation as a whole body issue. Section 6. Lifestyle choices and inflammation, taking charge of your health. The good news is that there are many things you can do to reduce inflammation and protect your health. Lifestyle modifications play a crucial role in managing inflammation and reducing the risk of chronic diseases. Diet. A diet rich in fruits, vegetables, whole grains, and healthy fats can help reduce inflammation. These foods are packed with antioxidants and anti-inflammatory compounds. On the other hand, processed foods, sugary drinks, and excessive saturated and trans fats can promote inflammation. Exercise. Regular physical activity has been shown to reduce inflammation and improve insulin sensitivity. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Stress management. Chronic stress can fuel inflammation. Find healthy ways to manage stress, such as yoga, meditation, or spending time in nature. Sleep. Aim for 7 to 8 hours of quality sleep each night. Sleep deprivation can increase inflammation. Smoking cessation. Smoking is a major contributor to inflammation. Quitting smoking is one of the best things you can do for your health. Section 7. Managing inflammation. Strategies for a healthier you. In addition to lifestyle modifications, several other strategies can help manage inflammation. Medications. Over-the-counter pain relievers, such as ibuprofen and naproxen, can reduce inflammation and pain. In some cases, your doctor may prescribe stronger anti-inflammatory medications, such as corticosteroids. Supplements. Certain supplements, such as omega-3 fatty acids, turmeric, and ginger, have anti-inflammatory properties. However, it's essential to talk to your doctor before taking any supplements. Alternative therapies. Acupuncture, massage, and yoga may help reduce inflammation and pain. Identifying and addressing underlying causes. If you're struggling with chronic inflammation, it's crucial to work with your doctor to identify and address any underlying causes, such as autoimmune diseases, infections, or allergies. Section 8. The future of inflammation research, promising new directions. The field of inflammation research is rapidly evolving, with scientists making significant strides in understanding the complex mechanisms underlying inflammation and its role in disease. This ongoing research is paving the way for the development of novel diagnostic tools and targeted therapies for inflammatory diseases. One promising area of research focuses on identifying specific biomarkers or measurable indicators of inflammation. These biomarkers could be used to detect inflammation early on, monitor disease activity, and predict response to treatment. Another exciting avenue of research involves developing targeted therapies that specifically inhibit the inflammatory pathways involved in different diseases. These targeted therapies hold the potential to reduce inflammation without the side effects often associated with traditional anti-inflammatory medications. As our understanding of inflammation continues to grow, we can expect to see even more innovative approaches to preventing, diagnosing, and treating a wide range of inflammatory conditions, ultimately improving human health and well-being.